Disparities in healthcare can impact a patient's experiences and outcomes. What are some common health disparities?
Yeah, there are so many, I think, and I think with colorectal cancer in particular, I think access is really a huge one. People who are in underserved communities, often people of color, often have, less access due to systemic racism in healthcare, in insurance, lack of opportunity with employment. I've always thought having a purely employer-based healthcare system is not the smartest idea. People who are often the sickest are the least able to work, and they're least able to maintain their health insurance. And so I think it does a disservice to our population to have things set up that way. And so yeah, I think that's a huge barrier. I think there's also a lot of stigma, especially amongst people of color around colonoscopies, things to do with your colon and rectum and whatnot. And so I think that's something that we also need to work on, to normalize that as something that should be done regularly, and that this isn't a bad thing. It's just something we all have to do.
Right. Well, what is being done by the medical community to address these imbalances?
I think a lot of I've really seen, I think, a legitimate push towards community outreach in the last few years. Unfortunately, we've known about these disparities for decades, and I think a lot has been said about addressing them since the 80s and 90s. But to be honest with you, I don't think very much was really done until recently. And what I've seen is, a really concerted effort to put resources into, identifying what are those barriers. Where is the distrust coming from? Who are trusted sources, in your community? And so, we're tapping into pastors and preachers and the barbershop, guy and everything. And you don't realize, you don't ask people, who do you trust to get your information from? If you don't ask the question, you're never going to know. And recently, I think we've actually really done the work to find out what is going to motivate you to get something done, what's going to make it feel normal to you and have you trust healthcare.
Right.
And so we're seeing a lot more engagement, I think, as a result of that.
So, are members of the medical community going out into the African American community to find out who they should be talking to?
We have been actually, I reviewed a grant, just to speak of Cleveland Clinic in particular. A couple of years ago, I reviewed a grant that the project that's being funded by it is still ongoing, where basically, we conducted focus groups basically of people at church. Actually, after the service was done, we conducted a focus group to ask them, what are your thoughts about screening? It was for colon cancer and for others as well. But what are your thoughts about this? What are your fears about it? What are things we could do to make you feel more comfortable with accessing this part of your care? And who do you go to get, trusted information? And so as a result of that, doing it, in their community, in the church setting, where they feel safe and they feel comfortable, we saw a significant spike in the number of people who came for colonoscopies, for mammograms. We do PSA testing, there, and we set up a lab there, and we found a big spike in the number of people who got those things done, and we identified quite a few people who had cancer. And at early stages, we were able to cure them, at much earlier stages than otherwise.